Thank you, Mr. Speaker. The difference between continuing care and long-term care nursing beds is significant. Before my mom passed away, she was in continuing care, and her health eventually deteriorated. Her doctor made it very clear to us she needed to go to a long-term care nursing bed, or she would have to stay in a hospital bed. Minister, there was no long-term care beds available. My mom was what you called or have referred to as a bed blocker. How many long-term care nursing beds do we have now, and how many long-term care nursing beds will we have next year?
Thank you, Mr. Speaker. I inadvertently used that term once, and I apologize for it. It was an improper term, and it shouldn't be used here as well. This Premier has made every effort to create as many long-term beds as possible. We have committed to delivering 750 beds immediately. It's going to take us a bit of time. 446 of those beds will be ready within the next 6 to 9 months. The other ones will have to be built. But we are searching through the system to see if we can find more. We're working with every supplier in the province to try to find ways to use the facilities they might have to increase the opportunity for long-term care beds. We're committed to it, Mr. Speaker.
First supplemental.
So, Minister, let's talk about your suppliers then. Given senior care providers were completely caught off guard by your suggestion that they would be suddenly turn their existing supportive living care beds into long-term care beds, as the spokesman from Aged Care said, we actually haven't had any requests from AHS to do this. Where are the beds going to come from?
Honourable Minister.
Mr. Speaker, we work through Alberta Health Services, and they've committed to making sure that the program will be completed. There's a very clear list. It's made public. We will have a certain number of beds ready in 3 months, in 6 months, in 9 months, and then we'll have to build some. So I don't know what the honourable member is speaking about, but my understanding is we're moving ahead on schedule. It will be difficult, but we're committed to doing it.
Final supplemental.
Thank you, Mr. Speaker, and Minister, I'll provide you with that information. Minister, not one of your new continuing care beds would have helped my mom or helped hundreds of other patients facing the exact same problem across this province. Given last year alone, you closed 200 long-term care beds, and the most recent stats we have, you have 571 seniors waiting for long-term care nursing beds, not continuing cares. Your numbers don't add up. You closed 200 this year. You indicated earlier you were adding 300. Where are you going to put the rest of the seniors?
Mr. Speaker, let's not forget that the Minister of Seniors has also announced an additional 1,200 beds on top of the 300 they've allocated for long-term care beds. In his group, there will also be long-term care beds. This is my allocation is the extra 300. We realize there are other people who are going to need long-term care support on the continuum. So we will continue to work with the Minister of Seniors to develop programs so we can have the beds needed. This is not going to be an easy process. We have also done everything we possibly can to ensure that beds will move ahead as quick as possible in cooperation with the Minister of Seniors.